Have you been trying to conceive for a while and the results haven't met your expectations? Are you exploring new possibilities on your journey to parenthood? Then you are in the right place. This video will explore one of the popular solutions that will help you conceive, that is artificial insemination or intrauterine insemination. Before we begin, let me tell you one thing. Having trouble conceiving is not a new problem. Many women go through this situation. Sometimes, though we are perfectly healthy, there might be certain medical complications that make it difficult for a natural pregnancy. These complications could be either in men or women or both. But you must not lose hope. These days, many treatments can help you conceive a baby. Of the many such techniques, one is known as artificial insemination. So let's discuss this method in detail and understand how useful it can be in your journey of pregnancy. Let us begin our module by learning what exactly artificial insemination means, what are the different types and their success rates, whether you are eligible for IUI or there are any risks or side effects. Do you need to take additional care after the treatment? How soon will you know you have conceived? And what other option do you have if IUI doesn't work for you? We will get rid of all these doubts from your mind by answering all these questions and more. So let's begin. What is artificial insemination? We all know how fertilization happens, right? Let me give you a quick refresher. During intercourse, the sperm travels through the vagina and the uterus and the fallopian tube, meets the egg and fertilizes it. But if this process is not happening properly, that is when artificial insemination comes into the picture. Artificial insemination is a method where healthy sperm is intentionally placed through the cervix into the uterus to improve the chances of conception. This is done close to the time of ovulation so that the chances of success are high. The overall process of insemination is straightforward and it is the fastest way of fertility treatment. With insemination, since the sperm is already in the uterus, it is easier for the sperm to fertilize the egg. Your doctor will suggest this as an initial fertility treatment when you have been trying to get pregnant for a long period. There are two types of artificial insemination. One is self, in which your partner's sperms will be collected for the procedure, and other one is donors, in which donor's frozen sperm will be used for the procedure. It will be chosen by your doctor as per your clinical conditions. So, when will your doctor suggest artificial insemination? There are many conditions in which you will be advised to go for artificial insemination. It could be because there is unexplained infertility. This is the case where all you and your partner's fertility tests are normal, but still natural pregnancy is not happening. Or it is because your male partner has fertility issues such as a low sperm count, decreased sperm motility or abnormal sperm shape. It could also be because of your cervix interfering with sperm movement into the uterus. In such cases, artificial insemination helps to bypass this obstacle. Another instance is if you or your partner have an immunological causes like anti-sperm antibodies. In normal circumstances, sperms are made in what is called an immunologically privileged area, in which they are relatively shielded from the body's immune system. When these barriers of protection are breached, the immune system can form antibodies against its own sperms. Some of these anti-sperm antibodies just float around in the bloodstream, while others can attach to the sperm itself. Even though most people with these antibodies have no fertility problems, in a minority of cases they can cause conception problems because they damage or kill the sperm. Next, if you have minimal to mild endometriosis, a condition in which cells causes inflammation in the pelvis and the reproductive organs, this condition make it challenging for the egg and sperm to meet and implant in the uterus. Another scenario where you are eligible for artificial insemination is in case of male fertility issues such as ejaculatory failure and retrograde ejaculation. That is when the semen enters the bladder instead of emerging through the penis during your sexual climax. In this situation, your partner might ejaculate very little or no semen at all. These are all the scenarios in which a couple is eligible to undergo artificial insemination. Your doctor will physically examine you and run the tests to understand the causes of your fertility issues. If you fall into any one of these categories, then they will suggest you go for artificial insemination. Techniques of artificial insemination. There are two techniques used to perform artificial insemination. One is called IUI, that is intrauterine insemination, and the other is called ICI, that is intracervical insemination. While their name quietly suggests exactly how they are performed, Let me brief you about each of them. In IUI, the sperm is directly placed in the uterus, whereas in ICI, it is placed in the cervix and the sperm has to move into the uterus and the fallopian tube. Let's talk about each procedure in detail. IUI, Intrauterine Insemination. In this method, the sperms are washed in a lab to remove chemicals in the semen so that the healthy sperm is used to raise the chances of pregnancy. Then, the sperms are put directly into the uterus to fertilize the egg. This is done in two ways, either during your natural ovulation cycle, which is usually between 12 to 16 days of your menstrual cycle, or just after you have ovulated. The IUI done during your natural cycle is called unstimulated IUI, and the one done after that ovulation is called stimulated IUI. In unstimulated IUI, more than one egg is released through medication to increase the chances of pregnancy. Once you decide you will undergo IUI treatment, there are some steps that you need to follow. You need to track your ovulation period. When your ovulation is normal, then the IUI method alone is reasonable and appropriate. But in case you have multiple unsuccessful IUIs, approximately 3 to 4 cycles, or if you are over 35-year-old, then certain medicines will be prescribed to you to improve the likelihood of success. Depending on when your ovulation will happen, the sperm is collected. The second one, medication. Depending on the infertility factors, you will be suggested to take a few medication to encourage the ovaries to produce multiple eggs. Here are some of the medicines that your doctor may prescribe you. The first one is clomiphene citrate, given to you if you are not ovulating. The second one is clomiphene citrate along with HMG, that is human menopausal gonadotropin. And the third one is clomiphene citrate with pure FSH, that is pure follicle stimulating hormone. Then the next one is clomiphene citrate with recombinant FSH, that is clomiphene citrate plus recombinant follicle stimulating hormone. Then the next one is HMG, that is human menopausal gonadotropin, and the other one is plain FSH, that is follicle stimulating hormone, and then the GnRH, that is the gonadotropin releasing hormone analogs. Most of these medicines are mainly prescribed to treat fertility disturbances, followed by ovarian stimulation. The next step is sperm preparation. In this step, healthy sperms that are in good shape will be collected. This step helps to eliminate inflammatory agents and decreases free radicals. These free oxygen radicals damage the sperm membrane, which reduce the motility of the sperm as well as its ability to fertilize the egg. There are some precautions that your male partner needs to follow before sperm is extracted. If your husband or partner has low sperm count or motility, it is recommended that they abstain from sexual relations for 3 to 5 days before the planned IUI. So make sure you follow all the steps that we discussed. We just talked about sperm preparation, which is one of the steps to be followed before artificial insemination. Let us see how that is done in detail. Healthy sperm is extracted from semen through any of the three methods. Conventional wash method in combination with centrifugation. Here, the healthy and normal shaped sperm from the sample of semen are extracted by putting the semen sample with a solution containing antibiotics and protein supplements and centrifuged repeatedly. This will be done for 40 minutes and the healthy sperm will be stored in a lab until the time of insemination. The second one is swim up technique. Here, a culture medium is put in the test tube along with the semen to which the highly motile sperms are attracted. In this way, unhealthy sperms are left behind. The medium that has the healthy sperm is carefully collected and used for the further process of storing the sperm. Then the third one is density gradient technique. In this process, the semen sample is placed inside a machine containing a solution and the machine is spun. This way, highly motile sperm and the unhealthy sperms are separated into different layers. The layer containing healthy sperm will be collected and the further process of storing the sperm is done. This method has a better success rate compared to other methods. Of all the three methods, the swim up technique is the oldest and most commonly used sperm preparation methods. Density gradient techniques are easier to standardize, and then the swim up technique and the results are more consistent. Usually, the choice of sperm preparation technique is decided by the nature of the semen sample. So, the swim up technique is often used when semen samples are considered largely normal. The density gradient technique is preferred in cases of male fertility issues because a greater number of healthy sperm can be recovered in this method. So, we discussed how to check the eligibility, what steps to follow before undergoing artificial insemination, and some of the methods used for sperm concentration. Now, you must be curious to know what is the exact procedure of artificial insemination. Let's understand that now. It is a simple procedure and takes hardly a few minutes. You will be asked to lie down on the examination table and your fertility specialist will insert a speculum into your vagina to see your cervix. This will feel similar to a pap smear if you had it done at any time. Next, a small tube called a catheter is inserted through your cervix into your uterus and your fertility doctor injects a washed sperm sample into your uterus through this tube. You will still be asked to lie down for 10 to 30 minutes after the insemination. Sometimes you may be given progesterone after the treatment as it helps to maintain the lining of your uterus and improves the chances of implantation. This process is usually painless. In some cases, there might be mild cramping and spotting for a couple of days, but you should feel normal after that. You can even have intercourse if you want to. Your artificial insemination will be successful and you will get pregnant if this injected sperm fertilizes the egg and the fertilized egg implants in the lining of your uterus. You will know if you are pregnant approximately 2 weeks after the treatment if your pregnancy test is positive. Now, what if you have undergone artificial insemination but it was not successful? Should you go for another cycle of IUI or should you look for other treatments like IVF? Let me answer these questions as well. You need to know how many cycles of artificial insemination you should try before moving on to IVF. Most fertility doctors recommend 3 cycles of IUI before pursuing another treatment like IVF. If you are over the age of 40, some fertility specialists recommend just 1 cycle of artificial insemination before moving on to IVF. This is because the success rates for IVF are higher if you are of this age group and timely treatment is important for you. In some cases, like if you have an endometriosis condition, fallopian tube damage or advanced maternal age, you are asked to go for IVF straight and skip artificial insemination. Benefits of IUI. IUI has some advantages like it can help you in overcoming the problem of vaginal acidity and cervical mucus hospitality. It helps you in depositing a good number of highly motile and normal shaped sperm in the uterus. A normal shape of the sperm has an oval head with a long tail, whereas an abnormal sperm will have head or tail defects. It is not very invasive and is less stressful for the body. It virtually has no pain and doesn't require anesthesia. It is also less expensive than other treatments like IVF and ICSI. There is a higher chance of pregnancy because healthy sperms are only used for fertilization. IUI has an 18% success rate. Risk factors of IUI. There are hardly any side effects of IUI. Some of the most common things are mild cramping or spotting, that is, a small amount of vaginal bleeding is expected. Infection might happen due to IUI, but it is very rare. There are chances of multiple pregnancies because sometimes more than one egg might be released if you take fertility medication. This increases your chances of becoming pregnant with twins, triplets or more. A pregnancy with multiple babies carries a higher risk of premature labor and low birth weight. Chances of OHSS, ovarian hyperstimulation syndrome. This is a rare side effect caused by taking too much fertility medication. Your ovary becomes painful and swollen. IUI is a good option for you if you are meeting all the eligibility criteria. Now, let's move on to the next technique, ICI, that is intracervical insemination. In this method, the sperms are liquefied for about 30 minutes and a harmless chemical is added to them to separate the most active sperm. These active sperms are put through your vagina and cervix through an injection. From there, sperms must navigate through the cervical mucus to reach the uterus and potentially fertilize the egg. The entire process is short and relatively painless. You will be advised to lie down for 40 to 45 minutes just to let the sperm get to work, and after that you can continue with your daily activities. The benefits of ICI is much faster than IUI and less invasive. It could cost you lesser compared to IUI and it can be done as a home insemination procedure with the use of cervical cap or syringe under the guidance of a healthcare professional. This way you can avoid more clinical setups. ICI has a much smaller success rate compared to IUI at 5%. This is the biggest drawback of ICI. Risk factors of ICI. Side effects of ICI are not very different from those of IUI. The risks differ from person to person and procedure to procedure. You may feel cramping and suffer light bleeding. In rare cases, you may develop a pelvic infection as a result of artificial insemination. The hormones that are induced to prepare the ovaries for ovulation can sometimes cause serious complications by resulting in OHSS. ICI combined with fertility medication can cause the risk of multiple pregnancies. The choice between IUI and ICI is decided by doctors based on the kind of fertility issues you are facing. They will clearly explain all the benefits, risk factors, and success rates of each of these methods. In this video, we have explored artificial insemination in detail. We have talked about both IUI and ICI methods of artificial insemination methods which can improve your chances of pregnancy. Both techniques offer different approaches for couples seeking fertility assistance. While you may be quite anxious about how the treatment happens, there is nothing to worry about. We have gone through each and every step of the treatment so that you are at ease while undergoing either IUI or ICI. With this information and your doctor's recommendation, you can make a well-informed decision and be completely prepared for your journey. Be assured, no matter what happens, Cloudnine is with you to ensure you have the best chance at a successful fertility journey.